I think that what we're seeing in the PBM space is there's a total black hole and lack of transparency. And I think what has to happen, and there are several bills in Congress, and the administration is creating greater transparency. The problem now in the PBM space is if you look at this, you see the list price of the drug and the real net price of the drug diverging like never before. It's like walking into a car dealership and seeing the sticker price on a car and what you actually pay for it. That shouldn't be the case, because the problem is with a higher sticker price or a list price, patients are going in and paying more. They're paying their share off of that list price as well as the insurer. So there's this really murky world, and we use this idea or the word of murky, of not understanding where these rebates are going, except in the PBM's pocket. So I think what you're going to see is a push both from the congressional side as well as the administration of greater transparency and finding out where are all these rebates actually going. The biggest problem that you have with the lack of transparency, again, is that the list price of these drugs keeps on increasing, even though the net prices in some cases are decreasing dramatically. Just saw an analysis of that, because there are now several pharmaceutical companies that are publishing on an annual basis their price increases and their difference between net to list prices. And so I think that when you have greater transparency, number one, we'll find out where all these rebates are going, and we'll see who's really benefiting. I think right now it's going into the pockets of the PBMs. You do have plan sponsors that are getting wise to this, insurers, and they're asking for a cut of these rebates. But where's the patient in this? Where are the providers? So what's the net result of lack of transparency? You have patients paying higher costs, cost sharing, whether it's deductible, whatever it may be, off of list prices. You then basically have the insurers, the system, paying more. But by having this divergence between the list price and the net price, you're fueling drug prices. So it's kind of ironic that PBMs, which set out to save the world and bring down drug prices, they're fueling them. And I don't care what any PBM says, if you look at the last 5 to 7 years, what have you seen? You've seen consolidation in PBMs. You see the top 3 PBMs controlling about 80% of the prescription drug market, but drug prices are not going down. They're going up. And why? Because manufacturers have to give, and I'm not just protecting the manufacturers on this, because they set the base price, but they basically have to account for all the discounts and the rebates they're giving away in their prices.